All right, well, it's 12 o'clock on the dot. I know some of you are sharing your time with us during your lunch hour, so we'll go ahead and get started. Welcome to our first session of Serving Our Athletes. Just a little housekeeping with Zoom. As a participant, everyone is muted because we're on a webinar instead of a Zoom meeting. If you have a question for Dr. Harvey, if you could please use the Q&A section at the bottom of your screen if you're on a computer. If you're on an iPad, it'll be up at the top. If you see a question that you would also like an answer to, you can upvote the question in that Q&A field so we can see that multiple participants are interested in the same question. Dr. Harvey's going to present for about 20 to 25 minutes, and then Lindsey is going to ask any questions from the Q&A section for Dr. Harvey to address. If there's something that you would like for him to go in depth a little bit more on one of the slides, go ahead and pop that question in. Lindsey's going to be monitoring those throughout, and she can stop Dr. Harvey if it's something that's pertinent to a current slide. So let's get started. USTA Missouri Valley is fortunate to partner with Children's Mercy Sports Medicine Center, which is nationally ranked by US News and World Report. Today's session will focus on returning to tennis safely and minimizing injury with Dr. Brian Harvey. I'm going to go ahead and turn it over to Dr. Harvey.
All right, good afternoon, everybody. Hopefully you're staying safe and healthy out there. Today we're going to talk about how we can get our tennis athletes back into sport really after this COVID pandemic, and talk about a little bit how we do it safely, where we are, and where we're going to go here. So just kind of overview of what we're going to talk about here is where are we currently with the return to tennis, return to sport. We'll go over some of the gating criteria. How do we know when we're ready? I think is a big question that needs to be asked. And while we may not get to a great answer today, we'll at least start to ask those questions. How do athletes and coaches really prepare from a training standpoint, getting back onto the courts? And then how do we get them ready for competition? We'll go through some of that, and then really what a safe return looks like, give some ideas and thoughts to really get the conversation started. But the question is, do we really know what our new normal will be like? And hopefully we can go through that over the next 20 to 25 minutes with you. So when we talk about the gating criteria, really that the CDC and the White House has given us, not just for return to tennis, but return to opening up society in general, there's a handful of things that we have to do to even think about opening up. And really it's, do we have a downward trend of this influenza-like or COVID-like illnesses? What is our cases doing from a caseload standpoint? Do we have a decreased number of confirmed cases or decreasing percent of positive overall tests? What are the hospitals like? Are they able to treat all patients without crisis care? And do we have this big, robust testing for patients, healthcare workers? And is there an emerging antibody test? And so when we look at our region currently, I think we can say maybe on the downward trajectory, particularly the influenza-like illnesses, maybe the COVID-like illnesses, just depending on where you are. I think the number of cases being decreased in some areas and increasing in others is a big concern depending on where you live. From a hospital standpoint, I think we are opening. I know at Children's Mercy we're starting to phase in our elective surgeries as well as our 8 outpatient centers. And so I think in most areas we can treat patients without a crisis care, but there are certain hot spots around that are still having some difficulty. Do we have a robust testing for patients, healthcare workers? Is there an emerging antibody test? I think maybe this emerging antibody test, it really just depends on how many cases you have in your area. So if you have 5 cases in your county, that antibody test probably is not going to be very good versus 5,000 in your area. And so I think all of these are a maybe. And so when we talk about can we return to tennis, everybody gets super excited. Let's go out and play. This is what we want to do. But I kind of think that we probably should think about this a little bit more and have a little bit more of a robust thought process getting into sport and tennis and how we do this safely. So are we ready for tennis in our region? And first and foremost, we've got to listen to the national, state, and local governments on any restrictions, physical distancing requirements, et cetera. This public health initiative really goes from everything on and their outbreaks and disease prevention to communication and surveillance. Phases can be altered or changed at any time. Kansas has just gone to phase 1.5 after hoping to go to phase 2. And so I really think that listening to your local health department, your county health department, and the state and national is something that anybody needs to be doing when it talks about returning to sport. So when we talk about returning, we really want to talk about a phased approach to sport, how we get back in. These are recommended at all levels. And you can get these phasing, whether it's at the CDC standpoint, NCAA, the U.S. Olympic and Paralympic Committee. This phased approach slowly allows players to ramp up in their sport participation, but also how much and how often they are potentially exposed, and gives organizations, schools, and tournaments time to prepare appropriately. So currently, phase 1, no more than 10 people gathering. We have to maintain our physical distancing. Virtual meetings and practices should be held. Those vulnerable athletes with health conditions should continue social distancing and shelter in place, and the gyms and common areas are closed. And essentially, this can be started once you've met your gating criteria that we just talked about. So really, that symptoms on a downward trend and cases decreasing over a 14-day period, et cetera. As we move into phase 2, essentially, we have to make sure that the gating criteria has been met again, and there's no evidence of a rebound in cases and deaths. And that phase 2 looks like physical distancing at that 6 feet, no more than 50, 30, maybe 60. It really just depends on where you're at, but gatherings are going to be limited. In-person training can be phased in, but really suggest virtual when possible. And the vulnerable athletes, those with health conditions, still continue to kind of avoid these larger gatherings. Phase 3, again, that's gating criteria must be satisfied, and there has to be no evidence of rebound or increase cases. So our vulnerable athletes, coaches, and athletics can resume in-person interactions. We can continue some physical distancing depending on your state and local health department. Minimize exposures to settings where distancing is not practical. So I wouldn't recommend, 100 people gathered in a 100-foot by 100-foot area. Gyms and common areas can reopen if appropriate sanitation protocols. So we got to clean appropriately. And those high-risk populations really shouldn't spend a whole bunch of time in crowded environments. And then staffing in your facilities can resume. So that's kind of the 3 phases that we're kind of talking about when we talk about phasing in sport. But where are we currently? So currently we're no gatherings more than 10 people. We're physical distancing at a minimum of 6 feet apart, potentially more. No sporting venues or tournaments are open. Sports are limited to really individual workouts. And we'll talk about how we can get those going. And some areas with travel restrictions are still out there. The benefit of tennis, when we talk about tennis specifically, is you can do these really pretty easily, but you have to have some thought into them. And so that's what we're going to go into now, is really how do we get athletes and coaches to prepare? Right now we've had upwards of almost 8 to 12 weeks potentially off, depending on where you are and when your shelter in place was ordered. And this has provided some athletes, fortunately, with some rest. It's given our athletes time to have some downtime and recover. We do recommend, up to 3 months of an off season per individual sport. So this has kind of had that built-in effect. There's really never a good time to be injured, but certainly now is the time to rehab old injuries. Even if you had maybe some shoulder pain or elbow pain or knee pain before, and now with all this rest is gone, we really recommend rehabbing that injury. You've got to address what those mechanics that were causing your injury. So if you had poor shoulder blade strength, you can rehab those. And so it's definitely one of those that you can take advantage of this time. injury prevention programs like the ACL prevention programs from FIFA 11 that's out there. I think this is a good time to really focus in on those. Doing individual workouts, we'll kind of go into as far as footwork and conditioning. I also encourage people to get 8 to 10 hours of sleep at night. And I think with this pandemic, we've stopped having practices and homework until 8 to 10 at night, and then having people get up at 6 a.m. So if your athlete has gone into the typical adolescent circadian rhythm, going to bed at midnight and waking up at 10 or 11 o'clock in the morning, that's great from an 8 to 10 hours at night standpoint. But as we start to transition back into sport, are we going to start having trainings again at 6 a.m.? Are we going to start to have tournaments that start at 8 a.m.? So really starting to push back that bedtime to maintain that 8 to 10 hours of sleep at night. I really think this is a good time to prepare mentally. Tennis is very much a brain game. And so if you aren't in a good spot, whether having some anxiety or depression over the pandemic that's come out, or have underlying anxiety, depression that's there, we really got to make sure that we're in a good spot. And I really encourage you to listen to our next presenter here in the next couple of days, who's going to talk about being prepared mentally. Of note, we also have a sports dietitian going to talk about good nutrition and hydration. I recommend having good eating habits and practices now. That way, when you come out of this pandemic, you can continue to eat a good, well-balanced diet that can prepare you for sport. So when we talk about kind of training individuals, we've got to talk about training to train. And this is where right now, individual tennis players can work on hand-eye coordination. We can work on footwork and skill development. And we do that either with the ladder drill, hitting on the wall, doing yoga, doing Pilates. I think that these are something that the individual athlete can certainly do. Tennis is kind of one of those unique sports. We've got to have endurance to play for a couple of hours. So working on the endurance, doing cardiovascular fitness with either running or biking or swimming, but also doing speed work, doing sprinting, doing speed and agility. I think all of these things we can be doing at home by ourselves. Think of essentially the Roger Federer and wall challenge. You just have to wear a cool hat when you do it. How do we get the coaches involved? Virtual training, kind of a new thing for most people. So you've got to be really creative and think outside the box. You've got to make sure you can interact as a group. I think that that's important for young athletes to continue to socialize, and sports has always been a good outlet for that. And so being able to have a Zoom meeting where you're challenging each other in an individual practice. Again, the coaches can encourage athletic development with footwork and speed and good hand-eye coordination, hitting on the wall, hitting into nets, and then really recording the coaches themselves on how to do on-court drills. Most parents aren't going to be coaches, and so having to teach parents on how to maybe hand feed a ball. But all these are potentials that you could do. And I always encourage people to go hit against the wall. It does produce some good footwork. It does produce some good hand-eye, and obviously gives you a chance to get out and hit. Most people aren't going to have the ability to hit across an open space like these two young ladies, I believe, from Italy, where they're hitting from rooftop to rooftop. And then working on their serve, I think, is important. That's something you can do individual. But with the cell phone or iPad, you can certainly record your serve and then send it over to a coach and see what they can do from distance. Once we're able to get back in person based off of, again, your local county, state recommendations, we really recommend an individual-based return. The biggest risk here is risk of injury. When you ramp up your workouts, going from maybe a couple hours a week to a couple hours a day, you potentially have an increased risk for acute and chronic injuries. And so to be able to decrease that, we want you to have an individual-based return. We want you to start kind of 25 to 50% of your pre-pandemic work. So if you were practicing 10 hours a week, well, maybe only do, 5 hours a week. If you were hitting 100 serves, well, maybe back off and only do 25 per day. So you can slowly ramp up. And this has got to be individual. You're going to have athletes who really took the time, did a whole bunch of cross training, did a whole bunch of individual workouts, and you're going to have some that just didn't have access to that. And so, to the right of the screen here, just a coming off of an injury style where you're just kind of hitting Monday, Wednesday, Friday. We're just going to do 12-4 hands on Monday, but then ramp it up to 15 on Wednesday and Friday for that first week. And we just slowly ramp up to where we're playing games by week 4. Do you have to go this slow? Maybe, depending on where you're at and what kind of level you are. Again, we really encourage a dynamic warm up. So making sure you can warm up very, very well, do your practice and then cool down. All these things can potentially decrease your risk of injury moving forward, particularly coming off a big rest break like what we've been seeing. So how do we return back into competition? This is kind of the big question. And so one of those things that we don't know, because if it's allowed by your state, is it allowed locally? Is it allowed nationally? What happens if we don't have that clearance? What happens if we don't have tournaments that have the safety nets and emergency action plans in place? Should we be playing at all? And so if it's allowed, if tournaments have these safety nets, if you have those emergency action plans in place, then I would consider a slow return even to competition. Tennis is relatively notorious in the youth as far as doing multiple matches per day. So do we want to limit those matches per day, which may limit the number of tournaments played or how big the tournaments can be, how many weekends you're playing in a row? Travel limitation is a big thing in return. So particularly when we're talking about this pandemic, the local spread has maybe been a little bit different than the state or regional or national level. And so really you have to think about all these things as we return back into competition. So real quickly here, what does the CDC and the USTA recommend? You can go on their website, which is at the end of this presentation, and kind of review these as well. But I want to encourage nobody to play, to train, or even to show up to practice if you're exhibiting any symptoms that could be of potential influenza-like illness or coronavirus. And those are fever, cough, difficulty breathing, sore throat, loss of taste or smell, or really any other symptoms identified by the CDC. I think what we're learning with coronavirus in particular is it can cause quite a bit of symptoms, anything from a weird rash to belly pain and diarrhea. So really look at that CDC website. If you're sick at all, don't come. Or if you've been in contact with somebody that has had the coronavirus in the past 14 days, we really recommend checking in with your physician if you've been exposed, if you've had a positive test, et cetera, before you come back in and train. USDA really recommends protecting yourself against infections, so making sure you're washing your hands at least 20 seconds or using sanitizer before you're going onto the court. I think cleaning and wiping down your equipment before you get there is helpful. Do not share rackets or any other equipment with anybody else. You should bring a full water bottle to avoid touching tap or water fountains or any jugs that are available. I would not use anything community at this point. And we'll talk about balls, but use new balls and a new grip if you haven't played in a while. Protecting others as well as yourself moving forward. The USTA website says maybe wearing gloves. That's a little bit potential there. If you talk to some of our infectious disease experts, wearing gloves may or may not help. And so I think that we'll leave that up to the individual player. If you need to sneeze, cough, or do anything that may spread mucus, do it in a tissue, do it in your shirt, do it in an upper sleeve. Don't just let it go. Arrive as close to your time as possible when you need to be there. So if you have a court reserved at 10 a.m., try and show up as close to 10 as you can be, and then leave immediately after you are done. That way this area can kind of air out if any cleaning needs to be done, and then it can be ready for the next players. And avoid using, touching court gates, fences, benches, and then really use that hand sanitizer after you're done as well. When you're playing, try and stay physically distanced. So no high fives, no fist bumps, no chest bumps. If you're going to play doubles, which could lead to incidental contact, try not to get close for when you talk to each other for strategy. Avoid all incidental contact. Try and stay 6 feet apart. especially during breaks and those kind of things. When playing, don't touch your face. That's kind of been well popularized here, but in particular after you've used your racket, touched a ball, those kind of things. Wash your hands if you do, so make sure you have some hand sanitizer there. Don't share anything. Stay on your side of the court. This may be a chance where you just avoid changing into the court. If you have to change into the court, just make sure you're taking those rest breaks on opposite sides. You don't need to be sitting right next to each other. If a ball comes your way, pick it up with your foot or kick it back to your opponent, or you can just pick it up with your racket and never touch that ball. We'll talk about some other ball etiquette moving forward. But if a tennis ball comes over to you, again, try and pick it up with your racket. Don't touch it with your hands or kick it back to where it came from. We do recommend potentially, if you can, having 2 brand new sets of balls so you don't end up sharing them. So, player A can have a number 1 on the ball. Player B can have 2, and you pretty much only touch your ball that's marked. So if I'm player A, I'm only going to touch the balls marked number 1. Making sure that if a ball comes up on your side that isn't your number, again, kick it back to your opponent, pick it up just with your racket head, try not to touch it with your hands. And if you do, make sure you sanitize your hands moving forward. All right. So in particular, just general good return to sport considerations. Again, participants, coaches, staff, anybody that's involved should have no symptoms. You should maintain your physical distance. Right now it's 6 feet. Make sure you maintain those guidelines. We do recommend symptom checks at the door, whether that's you're holding a practice when we can get there, whether that's holding a tournament when we can get there. But it really is, have you been exposed in the past 14 days? In the past 48 hours, have you experienced any body aches or chills? We recommend taking temperatures at the door. And if anybody has 100.0 degree temperature or higher, they shouldn't be allowed in. And then any new cough, shortness of breath, again, those symptoms that are coronavirus related, really be stopped at the door and not allowed in until their symptoms have resolved. They've got a note, they've got a test, something that they've been cleared. May have to limit participants in any practice camps or facilities for the foreseeable future. The government and state, local health department guidelines may facilitate that for us, but really may have to limit those. You may keep an empty court in between a couple of people playing just to encourage that physical distancing. And as we progress into group practices, keep the groups consistent. We don't want those exposures to be outside that 5 or 10. So using the pod method. And with that, you can keep the ball, the hoppers, the coaches consistent within that group. Again, trying to decrease that local exposure as much as we can, even as those restrictions are eased. As we get back into practice and really tournaments, potentially no spectators. This potentially would be parents as well. If you do have spectators and guardians and those kind of things, you have to be thoughtful and creative as far as how you screen them. Do they wear masks? Do you allow just one parent or guardian in? Do you have just an area for each person? You've got to be creative when you're getting back in and these restrictions are eased. We do recommend masks for coaches, as this is kind of the vulnerable group as we age. You could encourage your athletes to wear a mask, or if they want to wear a mask, they certainly could. Masking for athletic participation, I think, is a little bit controversial. We don't necessarily know exactly who should and shouldn't. I can tell you that I worked out for about 5 minutes in a mask, and it was pretty tough. And so it's one of those that if your athlete, your tennis player wants to wear a mask, I would encourage them. If they don't, make sure they can have a mask when they're not participating in drills. That way, again, they can decrease that spread, but they can take it off when they're playing or participating in drills. Make sure each facility has enough cleaning products to disinfect and sanitize based off the CDC recommendations. Initially here, I wouldn't recommend using any locker room or athletic training room, making sure you can physical distance in the bathroom. And as restrictions ease, we've got to maintain that 6 feet. And so even in the bathroom, maybe partitioning off one of the urinals or toilets so you're 6 feet in between. I would really consider a sign-in sheet or a roster for anyone participating in groups or individual workouts for really more than that 10 minutes, just so we can help the health department contact trace if we have an accidental exposure. So somebody comes to practice and they had maybe a little stuffy runny nose that they didn't report and they happen to be COVID positive. And expose people. And then we have to be willing to shut down facilities if you did have an exposure. And so really thinking through this, what's our new normal? That's a great question. And unfortunately, I don't think we know what the new normal will look like for practice, facilities, tournaments, travel. And I think as Albert Einstein kind of said here, the more I learn about coronavirus, the more I realize how much I don't really know. And so we keep learning about this thing. We don't know if there's going to be a second surge. We don't know what the summer is going to look like. We don't know what the fall is going to look like. Is it going to be safer to go indoors versus outdoors? Right now we're thinking outdoors, but as the winter hits and tennis being an indoor potential, we've got to think through that as well. And so there's lots that we don't know. Lots of questions still need to be asked. But I think as we get our athletes ready, we got to make sure that we train them to train. We've got to make sure that we can work on being an athlete and skill development, and we can really be creative with how we're doing our virtual practices moving forward. I do want to put a plug in for our upcoming sessions here. We do have that mental wellness session coming up, as well as our session 3, which is our nutrition from one of our sports nutritionists here. Both should be really great topics and hopefully answer some of those questions coming out of this pandemic as well. Here's a handful of references. The Aspen Institute does a really great job. The NCAA, the USTA, the USOPC, and then those gating criteria and phasing from the whitehouse.gov. And we'll kind of end there and open it up for questions here over the next kind of 5-10 minutes to see what we have.
Thanks, Dr. Harvey. I'm going to go ahead and show your camera in just 1 second here. And I do believe we have a couple of questions. Lindsey, do you mind?
Yeah, absolutely. We did have a couple come in. I'm going to start with the one that had an additional like on it. And it was jumping back to when you were reviewing the phases. The question is, who determines these phases? Is this done at a state or local level, or do organizations do their best to determine which phase they are in?
Yeah, so that's what's very tough. And so, living in the Kansas City metro area, we do have recommendations kind of coming from both the state lines as well as the local and county health departments. And so the answer is yes to all of those because it could be determined at the state level. The Kansas side is currently at the level phase 1.5, but it's going to be determined at the local level as well. As we reopen things. So certainly some places that were hit harder county-wise may not open quite as aggressively as those who weren't hit quite as hard. And so the answer is yes to all of those. I think the organizations themselves really need to pay attention to what their local as well as county as well as state is going through. So no good answer to those. And so I would really just pay attention to all of the health departments and recommendations.
Okay, thank you. That kind of leads us into the next question. How does this affect traveling across state lines or city to city?
Yeah, another great question. And so I would really be hesitant to do too much large amount of travel. Just because the restrictions and everything have been so different. And so I would really take a careful and thoughtful approach depending on where you go. So making sure you do your research from where you want to travel. Again, if it's going to be locally, if you're in Clay or Platte County, that may look totally different than Jackson County here in the metro area, which is definitely different than maybe say Miami County. And so it's definitely one of those that the way it affects it is you've got to know wherever you're going, their state and local rules. Watching the news last night, I don't think potentially maybe some people want to go play tennis in Hawaii, but Hawaii is essentially saying any tourists are going to get sent right back home. And so don't travel to play tennis in Hawaii anytime soon. And I think you've got to really pay attention when you're crossing state lines, city to city, because it really will be affected at the local level as well.
Okay, great. Another question that came in is, would you recommend players wear a mask to and from the court?
So yes, again, I think we've got to follow a little bit of what the recommendations are from your health department, which currently is kind of recommending masks in public forums. And so I would wear a mask right up until I started playing. And if my kids were going to be on the court in as we move forward, any type of small gatherings, because hopefully that'll be opened up soon. My kid they'll probably wear those masks until they're participating in that drill, and then put it back on when they're done participating in that drill, just to decrease the spread. I think you could make an argument as an athlete. We don't know how far particles fly when we run, jump, play, tennis, those kind of things. It could be anywhere from 6 feet up to 30. And so to wear a mask while participating in sport, I think is at this point individual, but I would encourage people to wear a mask to and from the court.
Okay, perfect. One more for you is, could you expand on the group clinics and processes?
So I think, again, that the groups are going to be dependent on what your local and county ability to gather in groups can be. I think when we start to get into groups, you've got to have a well thought out process from screening symptoms to recording potentially who's been participating, all the way through making sure you have enough cleaning supplies for your bathrooms if you decide to open them up, locker rooms if you decide to open them up. You should be maintaining physical guidelines from 6 feet. So it's got to be a well thought out plan. Once you're on the court, if you're in that 5 to 10, once we get phased in from allowing to gather within 10 on the court, they got to stay 6 feet apart. And so I think that it very much depends on what phase we're in and what your facilities can handle. I would encourage, if you're indoors, to have less people, just because we don't know what the spread can do there. If you're outdoors, you maybe hit closer to that 5 to 10 group. But again, I would start with individual workouts. I would start with virtual workouts, and then really move into coaches being present, and then move into some of the group and clinics and processes there. But you've really got to think about, if somebody shows up with symptoms, what can I do? And do I have a good process for that? And then how am I going to clean in between and those kind of things? So there are a handful of guidelines out there. USDA has some on their website, both facilities and player recommendations. If there's anything specific on the group clinics that I'm missing, certainly ask.
I think you covered it well, and kind of between the group clinics and the individual that you just talked about, this question kind of meets us in the middle. Could players meet with other players on their own to do their own practice?
Good question. And so I think it depends on your comfort level as a parent and athlete. Whether or not they've sheltered in place, you've got to assume that there is some inherent risk. If you're going to play with another athlete, there's going to be a potential risk there. The nice thing about tennis is they can be physically distanced. You can separate the ball count. You can do a lot of the things that we need to do. But again, you've got to follow your state and local recommendations from the health department. So your courts have to be open. I know where I live currently, our courts still aren't open for more than one person. And then once they are open, you've got to assume some infection risk when you start to play again. So if you're in an area that has a high new cases, probably not. If you're in an area that's relatively low on cases and hasn't seen that many, and you can physically distance and you are okay with accepting that infectious risk, you've got good policies and plans in place for you and the partner you're playing with. I think it's reasonable to do that.
Okay, great. We'll take this last question here. Regarding the camps, do you recommend a ratio to follow with amount of camp counselors to campers?
Good question. And again, camps are a little bit tough right now, just because we don't know where we're going to be, even in 2 weeks. And so once, I feel like a broken record, once your state and local health departments have cleared you, you've got to really stick to the recommendations of gatherings, number one. And then if you're going to have pods or groups, I would try and break them down as little amounts as possible, and then keep them in that group. So if you've got 30 kids coming to your camp, if you can break them into, 4 groups because you've got 4 coaches, that's probably better than, doing 12 persons per group. I don't have a good ratio as far as 1 to 5 or 1 to 10. But currently we shouldn't be gathering more than 10. And so that would be kind of my recommendations there, is really follow how many can gather based off of your health department, and then break them down as many as you can feasibly. If you've got 4 courts and you're trying to physically distance and break one apart, so now you're really down to 2 courts, and you've got 30 kids, that's going to be a little bit tougher. And so really having a thoughtful process, keeping people physically distanced on the court is going to be another one. And so no big number, but certainly there's some things that you have to think through.
All right. Thank you, Dr. Harvey. I want to thank all of you for taking the time to participate in our first session of serving our athletes. Again, our next session will be Thursday, May 21st, and it's going to focus on mental wellness on returning to play. If you haven't had a chance to register for the next session, there is a link to registration that can be found on our dedicated Serving Our Athletes page on our USTA.com. I appreciate all your time. I hope you guys get to grab some lunch, and hope to see you all on Thursday. Thank you.
Thanks, everybody.